Yeah, there's certainly a lot of challenges in regards to providing pulmonary rehabilitation for our patients with chronic lung disease. Pulmonary rehabilitation has been shown in many studies, many studies, to be effective. It's effective in improving the patient's exercise tolerance, in reducing their shortness of breath, improving their quality of life, and in some instances reducing hospitalizations as well. One of the things that we found certainly in the United States over the last several years is that beginning in 2010, CMS, or the Centers for Medicare and Medicaid Services, provided a method for payment for providing rehabilitative services or pulmonary rehabilitation. As the hospitals then, they created a certain code and they created a certain payment rate, which we thought was very fair. Over the next 2 years, as CMS then evaluates how much it costs to actually provide a service, due to some reporting errors that we didn't provide that the hospitals didn't look into when they provided this data, actually CMS lowered the payment rate. Lowering the payment rate has been really detrimental to many programs throughout the country. They simply can't provide the services that are out there for the payment rates that CMS has come up with. And one of the biggest challenge we have now is how do we correct that? How do we correct it? CMS did their job of looking at what hospitals reported, and because of the low reporting numbers, so to speak, CMS had that lower payment rate. What we have to do now is to challenge our hospitals and the individual people who report this data, called charge masters, at the individual hospitals, to report the data in as accurate a way as possible. Actually, what has been put together through the American College of Chest Physicians and other sister organizations, the Cardiac and Pulmonary Rehab Association, the American Association of Respiratory Care, the American Thoracic Society, and the National Association for the Medical Direction of Respiratory Care, have put together a toolkit that can be used by care providers, where you actually go to your hospital charge master and review what would be the appropriate amount of reporting, or the appropriate numbers to report, in hopes that CMS will then reevaluate things, which they do every year, and then increase the payment rate so that these programs can survive. It's really a shame in this country because we have such a well-proven therapy that can benefit many people that we simply can't provide because there's just not enough money that's being reimbursed for that particular program. Many programs in this country have closed actually over the last year or two because of that problem.